Hello, everybody, and welcome to our first webinar in the 2015 OSHA webinar series as part of the OSHA Defense Report. We are joined today by essentially the entire OSHA workplace safety practice here at Conn Maciel Carey, a new OSHA and labor and employment boutique law firm. We're so proud of the launch of our new firm, which is still just in its infancy, and the start of this new program. And we're so pleased that you all could join us today. We're very excited to do this interactive session, a group session with the different attorneys in our practice, and to talk about interesting OSHA issues, and so pleased that you all could join us for that. And we're very pleased to launch this webinar series and to start off with a topic like this that's really an overview. What's OSHA been up to in recent times? What do we expect they're going to be focused on going forward? And we'll touch on a series of important issues, generally at a high level. And then over the course of the webinar series throughout the rest of the year, we'll be getting into most of these issues we're going to talk about today in a whole lot more detail, as well as some other key issues. The program is intended to give you all the tools to manage OSHA enforcement and manage workplace safety issues at your workplace. And we put our heads together and came up with ideas and topics for this series, but we're open to other ideas that you all may have. So we're listening. If you've got topic ideas or questions, if we get common questions, we will adjust the series, add to the series, or look for great topics for next year. This is something we plan to do quite a bit going forward. So let me just tell you a little bit about who we are, and then we'll dig into our topic today. As I said, we are the OSHA Workplace Safety Group at Conn Maciel Carey. The person talking to you right now, the faceless voice on your computer, is Eric Conn. I'm the chair of the practice, and I'm joined today by my colleagues Amanda Walker, Kate McMahon, Lindsay Smith, and Andrew Summer. And I'll tell you a little bit about our practice and about some of the folks you're going to hear from. We have a OSHA practice here at the firm that focuses exclusively on workplace safety legal issues, with attorneys who are focused and specialized only in those workplace safety issues. We have extensive hands-on experience in all aspects of OSHA law, both in federal and state OSHA and other agencies that overlap with safety and health issues. Our experience and how we came to become OSHA attorneys comes from a variety of different backgrounds, including roles within the government. My practice, I started many years ago and practiced for more than a decade alongside the first general counsel of the OSHA Review Commission, where I learned the law from the folks who were writing the first decisions and helping to create the agency in its infancy. My colleague Amanda Walker, who you'll hear from later, was a presidential appointee at OSHA as a special assistant to the director of the agency, and then also served as an attorney in the Solicitor of Labor's office. One of my other partners, one of the other leaders of this practice, Kate McMahon, is formerly working for congressmen and committees on the Hill, advising on safety and health issues. So we come at this from a lot of different angles, from the executive branch, from the judicial side of the OSHA issue, and from the legislative side. Our associate, Lindsay Smith, who will be presenting with us today, just told me nervously this was her first webinar, so go easy on her. But she is really a wonderful OSHA lawyer, really has taken to this, quite naturally, and has helped us on a lot of OSHA matters. And Andrew Summer, partner out on the West Coast in our San Francisco office, is our, we call him our Cal OSHA specialist, but really he's an OSHA attorney generally, but with a specialty there in California OSHA and some of the other West Coast state OSHA programs as well. So I'm pleased to be joined today by my whole team here at Conn Maciel Carey, focusing on OSHA issues, and glad that you all could join us as well. So what are we going to be talking about? We're going to start off by looking back at 2014. The past is prologue. What can we learn from OSHA's enforcement strategies, OSHA's enforcement focus in 2014? What can we take away from that as we anticipate what OSHA is going to be up to in the future? So we'll look at enforcement trends and data for what OSHA was up to in the last year. And then, we got together, there's 5 of us here, and we said, okay, what do you think the most important issue is that OSHA is going to be focused on, or that our clients and contacts in industry ought to be focused on in the next year? We each came up with one, and we'll each talk about one important OSHA issue that you all should be paying attention to, or at least that we'll be paying attention to for you in the new year. So let's start with the year in review, and what has OSHA been up to? One of the places I like to start when I think about OSHA's activity in a year is, what did their budget look like? How much money were they spending on enforcement and their other activities? And this is an interesting trend that shows where OSHA's budget had been over past administrations and where we are now. And one of the interesting data points here, we show through 2012 where OSHA's budget was at the highest level it's ever been. But then all of a sudden, if you look at 13 and 14, which we've listed here numerically, the numbers dropped a little bit. It dipped down back towards the Bush W administration's budget levels. And you have to remember what was going on in 2013 and 2014. We had sequestration battles, we had the government shutdown battles, and we've had budget fights to cut spending. And OSHA was in that group with the rest of the government agencies that saw major cuts. So we have seen OSHA's budget drop a little bit in the context of sequestration and other budget cutting, but it is still at a historically high level. So what did OSHA do with those budget dollars? They did a lot of inspections. These are federal OSHA only numbers looking at workplace safety and health inspections. These are the boots on the ground. Compliance officer comes into your workplace either in response to an employee complaint, an accident, or just because you showed up on a list for one of their programmed inspections. They opened 36,000 workplace inspections just in the federal OSHA jurisdiction in 2014. You will notice that is the lowest number during this administration. I don't look at this as a trend that OSHA is backing down on its high enforcement mentality, high enforcement philosophy. I view this strictly as a consequence of the sequestration and government shutdown issues that we experienced in fiscal year 2014 for OSHA. So my guess is that 2015 will look more like the rest of the years of the Obama administration's OSHA. But it's interesting to see that they were able to do quite a bit fewer inspections in 2014 because of all the political shenanigans with sequestration and the other issues. So during these inspections, what were they able to accomplish? These are total numbers of violations issued. Again, fiscal year 14 was a drop-off compared to previous years of the Obama administration by about 10,000 fewer violations. So we had, going back, we had about 3,000 fewer inspections, 10,000 fewer citation items were issued. Again, I don't think this is the start of a downward trend. I think this is an anomaly because of the unusual political environment. Top 10 most frequently cited standards in 2014. This list is very similar to this same version of the list in years past. There was a little bit of movement in the order, but generally speaking, the top 10 remain the same. Fall protection in construction in particular, always a really high priority for OSHA. Fall protection in general industry also a high priority for the agency. Hazard communication, pay attention to that because that's going to be one of the first items in the top 5 to look out for in the new year. It is always a frequently cited standard in the OSHA portfolio. We think it's going to be an even higher priority for the agency in 2015, and we'll talk about why in just a moment. These are sort of the low-hanging fruit. These are the things that OSHA, it's their, in their comfort zone. They look for these issues during every inspection. They find them frequently. So think about that as you audit your own workplace and as you implement your own safety and health programs. What does our electrical safety situation look like? Do we have junction boxes with open knockouts? Do we have machine guarding where it's needed? Is it in place? Are employees, going around it? Look at those issues. Lockout, tagout. Are you doing your annual reviews and certifications? These are the things that OSHA finds most often, so they're the things that you ought to be paying attention to as well. This data point is one that I find fascinating every year. This is the percentage of in-compliance inspections. That means OSHA opens the inspection and finds 0 violations. And you can see that year over year during this administration, that number has been remarkably low. 26% in 2014. That means approximately 75% of OSHA inspections that are started result in at least one citation being issued. And the data point is not here, but I saw this the other day, that 83% of OSHA inspections include at least one serious violation. So if citations are issued, they include serious violations. So this is a pretty remarkable number, that there are so few workplaces that OSHA considers to be in compliance, indicates a little bit of the mentality once they start an inspection. I have heard compliance officers say before, I've got to find something to prove to my boss that I was there. This data point shows that there's some reality behind that mentality. Per serious violation dollar penalties. This is an interesting data point. When you look back towards the beginning of this administration, that number, sub $1,000 per serious violation was the norm, and the agency has successfully doubled the dollar amount per serious violation. And I dug into this number a little bit to try to understand it a little bit more. And I understand now that the numbers reflected here across all of these years is the final number, the final dollar number after informal settlement conferences, after formal settlement conferences, and after adjudication before a judge. So the as-issued penalty, it actually looks like it's up in the $3,500 to $4,000 range, but through the process that employers have to visit with OSHA or to challenge OSHA's findings, the penalties are cut. But even with the additional cuts that have been made, we see that the penalty number has doubled from the prior administration and historically. And we know that there's a number of ways that OSHA has done that in a very deliberate fashion to try to drive up penalties. They set a goal of tripling that number, and they're halfway there. They've done this by eliminating or dramatically cutting the available penalty reductions available to employers, either for size or for having a good, clean history. They've changed the way that they handle informal settlement conferences, taking away a lot of the discretion of the area directors and assistant area directors and how much penalty they're allowed to cut, and made several other changes solely for the purposes of driving up initial penalties and keeping up penalties after the citations are issued, and they're having some success in that area. The main way that they've driven up penalties on an aggregate, though, is not by driving up the average serious penalty. It's by finding and citing more violations as repeat violations. And many of you, if you've participated in other events that I've talked about, I focus on this almost obsessively. This has been, to me, the biggest weapon that OSHA has rolled out in a new way during the current administration to drive up penalties. And if you don't know the penalty structure generally, other than serious and serious violations, those classifications of violations carry penalties up to $7,000 per violation. But repeat and willful violations carry penalties up to $70,000 per violation, 10 times higher. And OSHA has stated, Dr. Michaels testifying before Congress over and over again complains that the penalty structure for OSHA is too small. It doesn't give the agency sharp enough teeth to affect change. And they have tried to find ways, and they've tried to encourage Congress to legislate higher penalties, because those penalty numbers I just talked about are set by Congress. And OSHA can't decide on its own, we want a higher maximum penalty. Only Congress can do that. So OSHA has found unique ways to drive up penalties without changing the maximum penalty per violation. Some of the ways we talked about a moment ago, getting rid of some of the penalty reductions that used to be available, but the primary way they've driven up penalties is by focusing on repeat violations. And look at this table here. I think this is one of the most interesting statistics that you see in the OSHA enforcement context, is that serious violations, even across different administrations, generally stay in the same band, in the $50,000 to $60,000 range. Willful violations generally stay in the same band. We saw a couple years where there were anomalies where OSHA had a couple of enforcement actions with dozens and dozens of willful violations that threw off the numbers. But generally speaking, you're in the high 300s to 400 to low 500 range for willful violations. But the one classification that we've seen climb year over year over year over year during the current administration is repeat violations. And it's essentially doubled in frequency that you get a repeat violation in a package. And there's a lot of different ways that they've done this. I talk about this in detail in other presentations I've done, but they are looking back further in time for past violations to serve as the basis for repeats. They are looking beyond individual workplace boundaries. It used to be that each workplace was its own independent workplace. Now they're looking at all of the sister facilities within a corporate entity, and any violation at any one of those locations, any federal OSHA state, can serve as the basis for a repeat violation at any other facility, now looking back 5 years to find that. And as a result, we see repeat violations going up and up and up. As a result of that, and you could see, serious violation penalties going up moderately, but yet we've seen, significant cases with penalties of $100,000 or more, doubled from the end of the Bush administration to the middle of the Obama administration. We saw it drop off a little bit in 13 and 14, again, I think because of sequestration and the other budget cuts. But we see it creeping back up in 2014. My guess is we're going to see 2015 looking more in line with 2011, now that they're back to full capacity and they've got a full year to operate. So we have seen these total penalties, total citation packages with penalties of $100,000 or more at a much higher rate in this administration than we have in the past. And then the $1 million cases, the egregious cases where they cite employee-by-employee violations or instance-by-instance violations that often will add up to these $1 million cases. We've seen those grow significantly from the past administration to the current administration. And it's hard. I mean, you're thinking back on that slide that the average serious violation is around $2,000. It's hard to cobble together enough violations to make $1 million case. And that's why we see this big focus by the agency on repeat violations is driving that result. One other data point that I think is really important, that I know is important to my clients, is the enforcement press release. This is when OSHA puts out a new set of citations. Very often they are accompanied by a press release posted on OSHA's website, often picked up by the AP, by local and national media, and these press releases describe the OSHA enforcement action. This is not a new concept within OSHA. OSHA has put out enforcement press releases for many years, but what we can see with this slide and with what I can tell you about it is it's used in a very different way by the Obama administration than it has been in the past. They're used much, much more often. You can see that the final 4 years of the Bush administration, they put out fewer than 600 enforcement press releases. The last 4 years here under the Obama administration, they've put out more than 1,800 enforcement press releases. The number of violations, the number of citation packages, the number of inspections has not changed all that dramatically, but they've put out 3 times as many enforcement press releases. So they're doing it more often. It used to be reserved for the most significant cases, generally those penalties with $100,000 or more or high-profile fatality cases. Now they put out these enforcement press releases for matters involving penalties around $30,000, which is a fairly ubiquitous OSHA enforcement action. So many, many more are getting these press releases. The other thing that's not reflected just in this data is the nature of the press release. It used to be, in all of the previous administrations, a very sort of black and white type of statement. Company X received a set of citations. The alleged violations were X. The company has 15 days to contest. These 1,815 enforcement press releases that have gone out during this administration, 100% of them included an inflammatory or embarrassing quotation from a senior OSHA or Department of Labor official, blasting the company, in derogatory terms, blaming them for an incident that may or may not have been caused by a safety program or caused by any management deficiency, but that doesn't stop them from these very inflammatory quotes. And the other big problem with this, if you caught sort of early in the discussion about the press releases, is they're issued when OSHA issues the citations, not when OSHA has proven that you've done anything wrong, not before the employer has had an opportunity to defend itself and prove wrong the alleged violations. This inflammatory press release comes out just when allegations are made, and it's never corrected. Those press releases stay on OSHA's website forever, and they are not corrected even if OSHA is proven wrong. If they allege you were a willful violator and it turns out the violation didn't happen at all, there's still a press release that talks about how you're a willful violator sitting out there, and now for 3 times as many employers are getting that type of treatment. So this is an interesting data point to track. OSHA has gotten a lot of complaints about this program, but you can see that they are not slowing down in that manner at all. So now let's talk a little bit about these top 5 OSHA enforcement or OSHA issues that we think are important to track in the context of the upcoming year, or really more likely the balance of the Obama administration. And the first one that I'm going to talk about is the continued implementation of the GHS Hazard Communication Rule. So let me just check questions real quick and see if there was anything on the past year that we want to talk about in questions. Yeah, so the one question that shows up here is, have we seen evidence of OSHA retracting an allegation in a press release after finding it not a valid allegation? And the point being that I've never seen that happen. I have seen a couple of employers get close to bringing a lawsuit against the agency to try and correct that public statement, but I've not seen that lawsuit filed, and I've never seen OSHA retract a press release, even if the entire enforcement action was proven to be invalid. That press release stays just as it is up on their website. So moving ahead here and talking about GHS hazard communication. Final rule was introduced or was rolled out in 2012 to modify OSHA's relatively long-standing hazard communication standard. Hazard communication standard is OSHA's set of regulations for employers to provide education and awareness to its employees about the hazardous chemicals that may be present in the work site or that employees may work with in the work site. It's commonly known as the right to know regulation. It's employees' right to know about the hazardous chemicals that they work with. In 2012, OSHA implemented a new final rule that changed the hazard communication standard in a significant way. That change was to align OSHA's, federal OSHA here in the United States, to align our hazard communication program and regulation with what was known as the globally harmonized system of classification and labeling of chemicals. And this was a sort of a standardized, United Nations standardized program for what we have referred to historically as material safety data sheets, how you describe the hazards and how you describe how to respond to an exposure to certain chemicals, and then also labeling of chemicals, labeling of containers and equipment that contains containers. It's all about standardizing those types of communication tools so that employees will be less confused about what the hazards are for the chemicals they work with. OSHA has quipped that this is taking OSHA's old right to know standard and making it the right to understand standard, so clarifying the communications about hazardous chemicals. So the biggest change that comes with the new GHS aligned hazard communication standard is how chemicals are classified and how those classifications of hazards are communicated to employees in consistent new formatting of labels and safety data sheets. The reason why I'm talking about this now as an important issue for us to all track in 2015 is that because this was such a major change and because it involved so many complex layers of change, manufacturers, distributors, changing labels, changing safety data sheets, and running it through the stream of different people who have contact with chemicals before and while it's in your workplace, OSHA set out a pretty lengthy transition period or rollout period. It's time to pay attention to this. It's time to understand what your new responsibilities are going to be under the new HAZCOM standard, and pay attention to this. Look out for, I know we're going to do a more detailed presentation just about the hazard communication standard later this year before June 1st as part of our webinar series. But look for other tools out there. Look at OSHA's website. Has a lot of good information about this, and make sure that you're ready for these implementation deadlines that are coming. Two most important issues I'll just talk about very briefly are safety data sheets and the labeling. And this is an OSHA quick card, a little fact sheet that OSHA put together to describe the new safety data sheet format. And the idea was, historically, there were certain concepts that needed to be communicated in the material safety data sheet. Used to be called MSDSs. Now they're just called safety data sheets, or SDSs under the new rule. And it used to be that the MSDS just had to include certain material in any format, in any order, as long as it was in there, you complied with the law. Now OSHA has said all SDSs must follow this particular format, broken out into 16 sections in this order, covering these specific issues in each section. So they're presented here. Generally speaking, unless you're a manufacturer, you're not going to be responsible for developing the SDS, but you will be responsible to make sure that your employees have access to these new format SDSs. If it means replacing hard copies in your right-to-know binder or your right-to-know center at your workplace, or if you rely on electronic SDSs, making sure that your electronic database has the current formats in there. The labels, labeling on chemicals, very different now. This includes chemical containers, small containers, portable containers, but also your big vessels that you might have in the workplace. Make sure that you're complying with these very specific new label requirements. They are common signal words, using specific words to describe hazards, the hazard classification that you've identified based on the new HAZCOM standard, or that the manufacturer or distributor has identified, and they involve these pictograms with red borders. They have to look exactly like this, and include certain hazard statements, again, using common words. The labels now will include precautionary statements, identifying the product, and identifying the supplier. These all need to be identified clearly on your chemical labels. So if you've been using sort of a recycled, reusable portable container, or you've got a tank, storage tank or vessel in your facility that has been labeled the same way for years, you've got to revisit that and make sure you're labeling it correctly. And if you're getting labels from your supplier that are not consistent with the new format, you've got to take that up with your supplier. They have responsibilities, but you also have responsibilities to your employees. So if you're using the wrong labels, the wrong containers, then you're going to be held responsible to that by OSHA in addition to the supplier. So pay attention to these issues. This is not the sort of thing I think that you can flip discussion on the hazard communication issue. I've talked throughout here, and you're going to get a break from my voice for a little while here, and let's hear from my partner, Amanda Walker, to talk about OSHA's new fatality and injury reporting rule. Amanda, are you there?
Yes, I'm here. Good afternoon, everyone. I'm going to talk a little bit about record keeping and the new rules coming into effect. Since Dr. Michaels, who leads the helm at OSHA, took office, he's had a strong interest in record keeping. It started with his national emphasis program on record keeping that you might remember back in 2009, 2010, and probably a little longer than that. He's also issued several proposals intending to modify the record-keeping regulations and reporting requirements. And as you might have guessed, a lot of these proposals were met with great opposition from the regulated community. However, he did manage to get some of these changes through. They came out last fall, the notification of these rules, and these changes went into effect January 1st, 2015. So this year will prove interesting as OSHA starts to issue more interpretations and guidance with regards to these new requirements, as well as starting to enforce them. So certainly something that you need to be aware of. So taking a look at the major changes with regards to this new reporting rule, you might recall that generally employers, the primary two reasons that employers contacted OSHA usually had to do when you had a fatality in the workplace or you had 3 or more employees hospitalized. OSHA has broadened the requirements, so now there's more reasons or more ways that you will now need to call into OSHA to notify them that there's been an incident in your workplace. In these ways, reporting to OSHA within 24 hours any inpatient hospitalization of a single employee. As I mentioned, this used to be 3 or more employees. OSHA's taken that down to 1 employee, and where it used to be 8 hours, it's now 24 hours. But the 8-hour rule still does apply for fatalities. The second major change with regards to this regulation is to report within 24 hours any amputation or loss of eye. Previously, there was some pretty detailed circumstances in which you would have to report an amputation, but now OSHA's broadened that to include all amputations and a loss of an eye, and that has to be reported within 24 hours. And it's important to note that these 24-hour time frames start ticking once the employer has knowledge of the hospitalization, the fatality, the amputation, or the loss of eye. So it starts ticking as soon as the employer is aware of one of these events taking place in their workplace. Other changes are that the reports can now be completed via a new online portal. Previously, you always had a hotline that you could call into to report these incidents. OSHA's broadened the way that they can now accept notice of these incidents. And then the fourth reason, or the fourth change, is to start publishing the data. OSHA hasn't been too clear on how they plan to publish this data, but they do intend to make it public. And as Eric mentioned earlier, this is probably a continuation of their shaming campaign that they've had ongoing with regards to press releases. And there's a great deal of concern on how they're going to publish this data, given that a lot of the information will need to be redacted so that it's not all publicly available, like with regards to the employee's name and other information like that. And there probably will not be given much context with regards to circumstances regarding the incident. So there's a lot of concern with how this is going to be published, and OSHA has not been very clear at this point. So something to look forward in 2015, something we'll probably get more information about. Moving on to the next slide, one question that's already developed even before the rule went into effect is what constitutes an inpatient hospitalization. As you might recall from the previous slide, that's one of the triggers that requires the reporting to OSHA is when you have one employee who is an inpatient or requires inpatient hospitalization as a result of a workplace incident. We've actually had some questions with regards to this, and going back and forth with OSHA, they actually, there's a variety of different meanings for inpatient services. Different groups have different meanings, insurers, hospitals, and patients. And OSHA's best guidance to this point indicates an employer should focus on whether handled as inpatient or outpatient more clearly understand what's required here. Just to give an example, if an employee is in the emergency room and has had a significant amount of blood loss and all of the treatment occurs in the workplace, but ultimately, or not in the workplace, but in the emergency room, and then as a result of the blood loss, they decide to admit the patient into the hospital to just monitor them overnight due to the significant blood loss, and there's no medical treatment provided after the emergency room and after the decision is made to admit them, that would not necessarily be reportable to OSHA under these new guidelines. Moving on to the next slide, final injury and illness record keeping rule. So the new rule went into effect in January 1st, 2012. OSHA indicated that plan states need to adopt this rule. We've actually contacted many employers with regards to, or state plan states to determine when they're going to be adopting it, and it's very across the board. a lot of them were not going to be adopting it immediately. They had processes that they needed to go through before it would become a final requirement in each state. So it's across the board, and if you have workplaces in state plan states, it's important to keep track of when that notification requirement is going to kick in there. And if you have any questions, we've done some research on that. We'd be more than happy to provide some guidance on that as well. So what are some of the changes we'll expect to see? OSHA is going to be getting a lot more notifications with regards to workplace incidents than they previously received. There's been estimates that it could be up to 25,000 more. So a lot of times they're not saying they're going to go out and inspect every incident that's reported, but I think that we'll probably see a very strong correlation between incidents being reported and inspections that result from them. So one thing to keep in mind is when you do make a report, you should start preparing for an inspection. The chances are pretty high that you will be getting one. And then more reports likely to equal more inspections and more citations. As I just mentioned, it's always a good idea once you make that call to start preparing for the inspection and start getting ready for OSHA to show up to be knocking at your door. And as I mentioned before with regards to the data, another change that we'll see with this is the public relaying of the information and a continuation of OSHA's chaining campaign. Moving on to the next slide, and as we mentioned in one of the substantial changes with regards to the new requirements is the online reporting option. Previously, it was just a telephone number. You could call the area office. You could report it to the local office, but OSHA's now set up an online reporting system. In that reporting system, we have some caution. Employers are able to do either option, either make the online reporting or make the call. And we're still recommending that clients make the call rather than doing the online reporting, which has a lot of blanks to be filled in by the employer. And a lot of times you don't have all the information by the time you're going to be making those reports. So, or the language or the information is likely to change. So we strongly encourage that employers call in the reports rather than just submit them online. And that information that is submitted shortly after the incident will or could become publicly available or be used in other ways in civil litigation. And then there's always this issue of electronic security risk. So that's a very high-level overview of the new fatality and injury reporting rule that's going to be coming into effect in 2010 and showing being an interesting trend to follow along with OSHA. Thank you.
Hi, everyone. My name is Lindsay Smith, and I'm an associate here at Conn Maciel Carey. And as Eric mentioned, this is my first webinar, so I hope you all can bear with me as I take you through a brief description of OSHA's Temporary Worker Initiative. So OSHA launched its Temporary Worker Initiative on April 29th, 2013 to, quote, help prevent work-related injuries and illnesses among temporary workers and to increase its own focus on those workers. And for reasons I will discuss, we believe this focus will only increase in 2015. So the first important thing to know in regard to this initiative is who exactly can be classified as a temporary worker. So OSHA defines temporary workers as individuals supplied to host employers but paid by temporary staffing agencies. So OSHA calls them temporary workers, but they are also known by other names. And the Bureau of Labor Statistics uses several different terms that all constitute temporary workers. So those are contingent workers, independent contractors, on-call workers, temporary help agency workers, and workers provided by contract firms. And it's important to know that, they have all of these different labels for your own purposes so that you can accurately classify who would be considered a temporary worker. So the reason OSHA launched this initiative were several different concerns that are displayed here. So first, OSHA believes that host employers are using temporary employers to skirt their OSHA obligations. Although host employers do not have the same exact level of responsibility to temporary workers as they do to their employees, there are important obligations that I will discuss in just a bit that are still upheld under the OSHA Act. OSHA is also concerned that these temporary workers are often placed in the most hazardous jobs and that they are more vulnerable to workplace hazards and retaliation. OSHA perceives that temporary workers are more vulnerable because they do not have the same type of relationship with the host employer and because they don't have the same type of permanency at that location, which OSHA believes may cause employers to put them into a more hazardous position and to retaliate against them if they complain about that type of treatment. Another concern of OSHA's is that employers are not giving adequate safety training or explanations of the duties that temporary workers will take on by the host employer or the staffing agency. Because temporary workers are in and out of job sites with different duties and different hazards at each site, OSHA is concerned that temporary workers are not receiving the necessary training before they are made to perform the assigned tasks and are exposed to the hazards at that particular work site. There is also a concern that there is a high rate of fatalities and serious injuries on day one of a job because the employers are not providing the necessary training, and the temporary workers are then exposed to these hazards without the protections in place that they need. And actually, around the time that the initiative was launched, there were several first-day fatalities that kind of prompted this belief within OSHA. And then finally, the size of the temporary workforce. Sorry about that. The size of the temporary workforce is expected to explode in the wake of the ACA. There is a provision of the ACA known as the employer mandate, and it requires that employers with 50 or more workers provide health care coverage to their full-time employees, which the ACA has defined as all employees that work at least 30 hours per week. For large employers, those with 100 or more employees, this mandate goes into effect this year. And for medium-sized employers, those with between 50 and 99 employees, this will go into effect in 2016. And because of the requirements of this mandate, there's a belief that this will promote the use of a lot of part-time work and thus a lot of temporary workers, because then the 30-hour threshold will not be triggered. And actually, there is evidence that there would be an increase in the amount of temporary workers used because in Massachusetts, where a very similar health care law was implemented, there was an increase in temporary jobs 6 times faster than the rest of the country. And OSHA believes that this could be the case nationwide under the ACA. Now going on to the actual temporary worker initiative. So the temporary worker initiative instructs compliance officers to focus on certain issues during an inspection. The first of those issues is determining whether any of the employees on site are actually temporary workers or should be characterized as temporary workers. And then after that, any of those identified as temporary workers, whether they are being exposed to hazardous conditions without proper protection, including, like I previously mentioned, receiving the required training. And whether that training is provided to the workers in an understandable language is a big component of the temporary worker initiative, because it is important that the employee understands exactly what they've just been trained on. And it obviously would be difficult to do so if the training was provided in a language that they did not know. And then finally, compliance officers are to document the name of the staffing agency who provided the temporary workers, its location, and the supervising structure at the staffing agency, because the staffing agency also has certain obligations to temporary workers, through a joint employer relationship with the host employer. OSHA may also inspect or cite a staffing agency if it believes that the staffing agency isn't performing its required responsibilities under the OSHA Act. For example, OSHA has actually instructed its compliance officers to inquire into a staffing agency's actual constructive knowledge of the hazards that temporary workers may be exposed to at the work site, because the staffing agency has a responsibility to apprise itself of such conditions before sending the temporary workers onto the work site. And this type of effort by OSHA actually often precedes a national emphasis program targeting specific industries. So that's actually something important to watch out for as data is collected and analyzed for this particular initiative. In the last slide here, you see a quote from David Michaels, the Assistant Secretary of OSHA, discussing the expectations for host employers and staffing agencies under that relationship I just mentioned, the joint employer relationship. So because host employers and staffing agencies share control over the conditions of a temporary worker's employment, both are held accountable under the OSHA Act. For example, a host employer is most often responsible for recording any injuries to temporary workers on their 300 logs because it's usually the entity that provides the day-to-day supervision of the worker. However, the staffing agency also has a responsibility in that sense because they have to maintain communication with their workers and the host employer to ensure that all injuries and illnesses are properly recorded and reported. Additionally, staffing agencies are expected to provide general safety and health training that applies to multiple different types of work sites, while the host employer is expected to provide training that's specific to the duties and the hazards that temporary workers will undertake at that particular work site. So to avoid citations, each of these entities must understand the responsibilities that they have. And one effective way to do that is to specify those obligations of the host employer and the staffing agency in the contract between the two types of employers for the staffing agency's services. So because of this likely increase in the use of temporary workers in 2015, and the fact that OSHA continues to provide guidance documents directed to both its own inspectors and employers on this issue, we predict that there will be an increased activity and attention by OSHA to this initiative in 2015. So I will now turn it over to my colleague, Kate McMahon.
Good afternoon, everyone. It's very good to talk to all of you. I will take a portion of the remaining time we have to talk about the rulemaking agenda that remains in this last 2 years of the Obama administration. And I could talk for hours about this, but we want to save some time for my colleague in California, Andrew Sommer, to talk about what's going on in California. So I'll try to keep this brief and focus on the real highlights, both from a process and a substantive. First of all, as you all are keenly aware, we have 2 years left in this Obama administration. From a rulemaking perspective, though, what that means is we do not have 2 full years. We probably have about 5 quarters of rulemaking activity. If history is a guide or, past is a prologue, I think it tends to be the case almost always that we don't see any significant rulemaking activity after the spring of a presidential election. So we've got 5 quarters left, or I should say the agency has 5 quarters left, and that is not much time, especially at OSHA, to get rulemaking activity either underway or completed. Especially because we now have a Republican Congress. Republicans control both houses, and the Republicans are raising real questions about some portion of this agency's rulemaking agenda. so we expect that there will be difficulty on Capitol Hill to move forward, at least in some of the significant areas that the agency is. Let me talk about what I think we're likely to see, and probably as important, what we're not likely to see over the next 2 years. But before I do that, let me just take a couple of minutes and talk about, my assessment of the agency's rulemaking performance. Notwithstanding all the hype that we had at the beginning of Dr. Michael's term, and contrary to the very active agency that we've seen on the enforcement side, as my colleague Eric has just talked about on some level, the agency's had, I think, very little success on the rulemaking side. In fact, I would think Dr. Michaels himself, at least privately, would probably give himself, if not a failing grade, a pretty low grade in terms of what he's accomplished in the regulatory area. I know he's felt stymied and frustrated by the process and by the support that he's had. Well, I shouldn't say I know this. I suspect that he has felt stymied and frustrated, and by the support he's had from his own White House. You recall, the reasons for this are I think, twofold generally. First, recall he began his tenure with a lot of ambition and great, robust objectives. When I say great, I mean very large, robust objectives. But he began when we were, right in the midst of one of the greatest recessions, or the greatest recession we've had since the Depression, and his own White House, in fact, in particular, and critical to the rulemaking process, the Office of Information and Regulatory Analysis, OIRA, within OMB, was very concerned about economic burden that rules would have on industry or business. And so Dr. Michaels was not able to garner the support that I think he probably would have liked to see at OIRA to support some of his large rulemaking initiatives. Probably remember the hearing conservation major overhaul that he hoped to implement. That failed. MSDs on the record keeping logs. Ergonomics. We heard a lot about ergonomics early on. We don't even talk about a new ergonomics rule these days. So there wasn't as much support because primarily of the recession and the concern about economic burden that rules would cause from the White House. Second, and I think fundamentally, the entire system, whether you're a Democrat wanting a lot of rules or a Republican wanting limited rulemaking activity or strategic rulemaking activity, the system is, it's either broken or maybe it never was built very well to support efficient and effective rulemaking. It's a very cumbersome process. A lot of procedure is required. Even where the OSHA Act and the APA give some discretion to the agency, they tend to err on the side of more rather than less process, for instance, with public hearings on every major rulemaking. And the agency is burdened by a very limited resources, and a lot of the resources they have, they put on the enforcement in their enforcement effort. So it's very difficult for the agency, with the process and the limited resources they have, to move effectively through through the rulemaking process. End result is it takes a god-awful long time to promulgate a rule. I think the agency's own estimate is it's something close to a decade, and I think if you look at statistics, the average time it takes to promulgate at least a major standard for the agency is 12 to 16 years. So, not a lot of time and very short time left. What do we expect in that short time left? Let me move to talk about what we think we will and won't see. First of all, what I think we can feel pretty safe that we will not see is I2P2, which, as you probably know or may know, the illness and injury prevention program that is affectionately referred to or infamously referred to as I2P2 is something that I think Dr. Michaels wanted to see promulgated as a rule in his administration very badly. That is highly unlikely to occur. Combustible dust, another major rule that the agency was very focused on in the first term. It's not even appearing on the most recent regulatory agenda. They continue to do some rulemaking activity, but it's highly unlikely that we will see a rule on combustible dust in this term. And silica, what became after I2P2 essentially seemed to fail, silica became the key rulemaking activity of this administration. We did see a proposed rule. It took OIRA really put the brakes on the silica rule for a number of years. Finally did see a proposed rule. It was large, and it received enormous amount of negative comment from the business and from business and industry. And there is a lot of talk about whether, if the agency moves forward, whether the Republicans on the Hill will work to prohibit the agency from finalizing the rule. In my view, it's probably more unlikely than likely that we'll see a final silica rule. On the maybe side, and I don't even have a yes slide, but I do have a maybe slide, and there are some key rules that we need to be aware of and focused on in all the sort of major areas where OSHA promulgates rule. On the occupational health side, chemical rulemaking, in the construction sector, of course, typical sort of bread and butter safety rules, and in the record keeping area. So I have one slide here that sort of outlines my view of where we're likely to see some progress, at least, being made in the rulemaking area within those categories of rules. I'm not sure we have time to even move through all of these, so let me highlight at least a couple. On the safety side of the house, the agency, I think, will promulgate. We will see a final rule on the walking working surfaces. As you may know, OSHA's been working on this rule since 1990. So, quarter century later, we may see a rule. I have pretty good, solid information that the agency believes they are very, very close this time to promulgating a final rule on walking working surfaces. I think we will see that. There are some relatively minor rules that I think we will see finalized. On PPE, the eye and face, it's essentially an update to include in the regulatory standard the new 2010 ANSI standard on eye and face protection. On respiratory fit testing, I think we're going to see further rulemaking activity there. What the agency is considering doing is revising Appendix A to include 3 new methods for respiratory fit testing that I think are designed to make the burden a little less and make it a quicker process to do fit testing. So those protocols ought to be looked at, and we will keep an eye on those. Communication towers, Dr. Michaels and the front office of the agency is very focused on the tragic deaths that occur in the communication towers industry, and so I think if they've prioritized that as an area where there may be rulemaking activity, and as you may know if you work in the industry, they are working closely with NATE, the trade association that organizes that industry, to develop further rulemaking and safety standards. Emergency response and preparedness, that's essentially an update, and I think that the agency feels, as they do on the infectious disease standard, that because of the Ebola scare last year, and because of the high-profile accidents that that have triggered a lot of activity in the White House, including an executive order in August of 2013. There's political support for updating the emergency response and preparedness standards. Record keeping proposal. Amanda Walker talked a little bit about the final record keeping rule that was just promulgated last September and went into effect in January. There's a yet second record keeping revision that OSHA would like to promulgate. It's in proposed form now. Comment period ended last spring, and it's something to really keep our eyes on. What this does essentially is, although it does not change the what has to be recorded on the OSHA 300 logs, it does make those logs for a large group of employers, required to be transmitted electronically to the agency, essentially on a close to real-time basis. And we have looked at the rule very carefully. We're happy to talk to you, offline or in another forum about that record-keeping proposal. It's very important to track what's happening there. Construction, there's a couple of updates. The operator certification rule, there's an extension till 2017 for that, and OSHA does want to promulgate a confined space rule in the construction area. They have prioritized that, so look for further activity in that area. And then finally, there's series about infectious diseases, and on the chemical safety front, beryllium, I believe we may have. I've been involved in that rulemaking personally, and I'm hoping that we will see a final rule before the end of this term. And then finally, I can't stop talking without at least mentioning Dr. Michael's efforts on the chemical management in the chemical management area. There is a rule that has been proposed to overhaul the PELS process. I think that is an area that deserves a lot of attention, both on labor as well as employer side. The comment period is open through April. I think it's a very fascinating, very interesting proposal. I think we all ought to be keenly focused on it. Everybody across the board recognizes that process is broken, and there ought to be a better way to establish chemical risk rules and permissible exposure limits. And I think everyone ought to think about very seriously engaging in that process. And we'd be, of course, happy to talk to you about that another time. So with that, let me end my short part of the presentation and turn this over to Andrew to talk about Cal OSHA. Andrew?
Good morning or good afternoon, depending on where you're located. My name is Andrew Sommer. I'm a partner with the California office of Conn Maciel Carey, where Cal OSHA is relevant. And I want to discuss with you a couple of the California-specific developments. There are two bills that were signed into law effective January 1st of this year. The first one is AB 1634. That's on the next slide. And that bill came up for approval, was actually signed into law by the legislature, and was legislated and then was vetoed by the governor. Now, with the backing of organized labor, this bill this year has been signed by the governor and has two very significant changes for California employers. One concerns penalties and the other concerns abatement. As for penalties, this new law prohibits the Division of Occupational Safety and Health, which is the agency in California responsible for enforcing the workplace safety laws, and it prohibits that division from modifying penalties for any serious violation unless the employer has abated that violation at the initial or subsequent inspection prior to the issuance of a citation, or second, where the employer has submitted a verified statement under penalty of perjury with supporting evidence showing that abatement has in fact occurred, and this statement must be provided within 10 working days after the end of the period fixed for abatement. But perhaps the more significant change in this law is that no longer does California allow an automatic stay on abatement while there is an appeal of a citation. Now, an employer is required to affirmatively file a separate request for the stay, which can be costly. It's a separate appellate process, and in that petition, the employer must demonstrate that the stay will not adversely affect the health and safety of employees. So it's creating this double appeal process to the great consternation of employers in California, and it is requiring that employers have some advanced planning, because this is going to take a considerable amount of work, and an employer cannot wait until it's on the eve of filing the appeal, but must plan for this. And this bill overall raises some very significant due process concerns, because you could have a situation where the agency simply erred in the citation that was issued, or is ordering infeasible or unnecessary abatement, but the employer is required to go through this very onerous, costly process to achieve abatement. So this is one new law in California that's going to require significant planning by employers where there are serious violations that are being challenged. Now I wanted to move to the next new law, which is AB 326, which is a relatively minor change in the law. It's essentially modernizing the reporting process in California, whereas before the reporting of injuries was by telephone or telegraph, and they've changed that to telephone and email, which obviously makes sense for those of us in the modern age here. But I'm using this as an opportunity also to explain the reporting process in California, which is a bit different from the federal standard, but that an employer is required to report any injury or illness that results in lost time beyond the date of the injury or illness, or that requires medical treatment beyond first aid. This report must be made within 5 days after the employer obtains knowledge of this injury or illness. However, where there is a serious injury or illness or death, that report must be made within 8 hours after knowledge. And a serious injury is any loss of any member of the body, a serious degree of permanent disfigurement, inpatient hospitalization in excess of 24 hours other than for observation. So in recap, there is a detailed process in the regulations, but essentially for a serious injury or illness or death, the employer must submit this report either by email or by telephone. So that concludes the brief California section, and I believe there's some questions available now.
All right, so we'll open it up to questions. I think there's not a good way to unmute any audio lines, so just as a reminder, if you don't see the notes we've been exchanging here in the chat box in the bottom left of your screen, that is a great way to type in a question and we can address it that way. Likewise, any of us who have spoken today are always happy to field a call or an email with any questions you have after this session. As we've noted, we are going to make a link to a recording of this webinar available, and we'll circulate a copy of the slides as well. While we get, if some additional questions are coming in the meantime, I do want to point out that this was webinar number 1 in our 2015 webinar series, and there's a bunch coming up. starting in the middle of February. We'll be diving in a whole lot deeper into OSHA's temporary worker initiative and getting into that sort of division from OSHA's standpoint, division and responsibility between the host employer and the staffing agency as to who's responsible for different OSHA Act obligations, and talk a whole lot more about best practices for how to manage those joint responsibilities and the potential enforcement liabilities that come with that. Over the course of the rest of the year, we'll be talking about a much more detailed review of OSHA's GHS Hazard Communication Standard, my one-slide discussion about repeat OSHA violations. I could talk about that for a long time, and I will, in May of this year in a webinar just about OSHA's follow-up inspections, sister facility inspections, repeat violations, and the sort of overall cumulative effect of OSHA enforcement on larger national companies or companies with multiple facilities. In June, we're going to do a presentation about preparing for and managing OSHA inspections. In August, we'll have a webinar about America's aging workforce, some of the unique safety and health issues and enforcement issues related to the senior workforce that is growing every day in this country. There is a program that OSHA has called the Severe Violator Enforcement Program. We'll be reviewing what that is, how employers get into it, more importantly, how to avoid getting into it, or how to get out if you find yourself in that unfortunate circumstance in October. In November, we'll be talking about a really hot enforcement issue, which is workplace violence. We'll be doing that in conjunction with labor and employment attorneys here at Conn Maciel Carey about some of the overlapping employment issues and OSHA issues in that regard. And then we'll finish off the year with a presentation about privileged investigations and better report writing, incident report writing. So that's what we have on tap for the rest of the year for this webinar series. If you're interested in all or some of these, registration is available online on our website, connmaciel.com, or just send an email to any of us and we'll make sure that you get registered. We do have a couple questions coming in here, so we'll take a quick look at those. And otherwise, we're always available. And if you didn't capture it, I don't want to insult my colleagues, but at least myself, I'm a huge OSHA nerd. I love talking about this stuff. I love hearing about your experiences out there, so please don't ever hesitate to call or shoot me an email with an interesting question or an interesting experience you've had with OSHA. We love to hear about it. So I see a question here about if you go to a clinic or a hospital to have an employee looked at, but he is not staying overnight, is that an incident that has to be reported to OSHA? So the key there that OSHA has suggested that employers really focus on in determining whether a hospitalization event is a reportable incident is whether the employee is admitted to the inpatient service of the hospital or clinic. So if you're in the emergency room, even if you're in the emergency room having a relatively major surgery, if you are somehow after that released outpatient, that is not a reportable injury. Even if it was major medical care provided, if you are not admitted to the inpatient service, it's not reportable. So the key is the inpatient admission. There are many circumstances today in our healthcare environment where you might spend a night, might even spend 2 nights in the hospital and still not be admitted to the inpatient service. And if that's the case, it's not a reportable injury. And very importantly, if you are treated medically in the emergency room and kept overnight, even admitted to the inpatient service for several nights, but only for observation or for diagnostic purposes, that's not a reportable injury. So you have to be admitted to inpatient service and treated medically after you are admitted to the inpatient service for the injury to be reportable to OSHA. We have an article we're about to put out about this, and we're actually about to launch our blog, the OSHA Defense Report blog, sometime in the next month or two, so you'll see some detailed writing by us. If OSHA does not do a good enough job putting out their guidance and interpretations, we'll be doing a lot of writing on this topic to make sure it's clear to you. But OSHA gave us an example of an injury that was not reportable that I was a little surprised that OSHA took that view. It was my view, but sometimes we don't see eye to eye. But their example was an employee breaks his leg, goes to the hospital where his leg is about to be set in surgery in the emergency room, and he begins to bleed out. They address the bleeding circumstance and then set the leg surgically, and then decide that they want to keep the employee overnight for observation because of the blood loss. So he's admitted to the inpatient service of the hospital only for observation after some pretty serious medical treatment. OSHA's an enforcement leader over at OSHA indicated to us that that was an example of a non-reportable hospitalization, because the hospitalization, the inpatient portion of his hospitalization, was only for observation. So in that circumstance, not a reportable injury. So that was it's a great question. I think this is going to cause a lot of confusion for employers. Is a hospitalization a reportable injury? Not all hospitalizations are. You've got to look at them case by case, instance by instance. So that's going to be I think the biggest confusion area in that context. So great question. And if there's any other questions, we'll dig into that. If not, we will say thank you again for joining us. We will continue to work out some of the kinks as we get our webinar series off the ground. We're so glad you could join us, and we look forward to doing many more of these together. And again, if you have good ideas for topics, let us know, and we'll be happy to dig into that for you. Thanks again for joining us, and we'll look forward to visiting with you again soon.